Hi, everyone. I'm Dr. Darian Lesicko, and I go by Dr. L at Anasa Medicine. And today we're going to be talking about inflammatory bowel disease and specifically how naturopathic medicine can help support those individuals who do have this condition. So let's get into it. So let's talk about first what exactly is inflammatory bowel disease. So that's basically just an umbrella term for a group of conditions that's characterized by this chronic inflammation happening in the digestive tract. So the two most common types are ulcerative colitis and Crohn's disease. And those kind of differ based on where in the digestive tract that inflammation is occurring. So for Crohn's disease, it can actually happen anywhere along the GI tract. And then ulcerative colitis, it's typically just in the rectum and the colon that that inflammation is happening. And then why do we care about talking about this? It's because it's really prevalent. So, unfortunately, like 3 million US adults have been diagnosed with IBD. And then, of course, just based on that disease process, you can imagine a lot of them are suffering with a lot of digestive symptoms. So, a lot of abdominal pain, diarrhea, rectal bleeding. So, obviously, that's a huge negative quality of life that they could have be having. And then also systemic symptoms, so fatigue, weight loss, even mental health issues. Those can also be, again, correlated as well. So, obviously, something we really care about managing and making sure that people with IBD are supported. So, why exactly does this inflammation happen with inflammatory bowel disease? It's typically a combination of the factors that I listed on this screen. So, genetics, right? If you have any sort of change in your genes that allows for this kind of overreactive immune response, that can contribute to this disease process. Something called dysbiosis. That's another word for basically an abnormal composition of our gut microbiome. So we all have trillions of bacteria in the gut, but we really care about the kinds of bacteria present in the ratios, right? So how much good bacteria to bad bacteria do you have? If you have more bad bacteria, that can be more pro-inflammatory and contribute to that overreactive immune response. Leaky gut. So, leaky gut, that's another term for intestinal hyperpermeability. It's basically when we have tight junctions between the cells in our gut, they kind of degrade. So then you have holes in your cell lining where bacteria, food particles can get through and into the bloodstream. So then obviously that shouldn't happen. So your immune system can overreact and contribute to this disease process as well. I'd say for leaky gut, it's interesting because that can actually be either like a cause or an effect for IBD. So obviously something nonetheless that we should help manage. A lot of different environmental triggers can play a role. So diet is a huge one, right? Diet can be pro-inflammatory or anti-inflammatory. Chronic stress, they've found different types of infections, recurrent antibiotic use, right? Anything that changes that gut terrain. So yeah, a lot of different triggers for that. And then also defective immune system. So do you not have the right breaks in your immune system cells that help stop your immune system from overreacting, right? Once a threat is handled by our immune system, it should shut down. It shouldn't keep going. So if you're missing like those break cells, then that can obviously contribute as well to this disease process. So again, a lot of different potential root causes. So, based on those root causes, I just wanted to briefly touch on conventional medicine. Obviously, that's not why we're here today, but I just wanted to say, like, definitely there is a time and a place. They are really important and can be really effective for helping to control someone's symptoms with IBD. So, a lot of different types of pharmaceuticals. You can see I listed them out here. Surgery is an option as well. Um, but they also play a role in helping symptom management. And that's what I wanted to bring up. So, for example, immunosuppressants, they help control that immune system response. You can see how that would be beneficial. Corticosteroids, they play a role in helping to stop that inflammation cascade. So you can see how that would be beneficial. I would say though, so some negatives is it's usually not a one size fits all approach. So a lot of patients won't actually benefit from these medications, for one. And then they all have their own side effects too, right? So that's also something to keep in mind. So, for example, like corticosteroids, 30% of patients won't respond to them. So Usually, you see a lot of patients on a lot of different medications having a lot of different side effects, and then their symptoms still aren't even managed. So that's where I think it's important to have other options, right? So when there's that limitation to these conventional options, what else do you do, right? So I feel like that's where naturopathic medicine can play a role is to help kind of fill in some of those gaps. So you can see, I just wanted to show this. It's what we call the therapeutic order of naturopathic medicine. So this helps guide our treatment. So you can see conventional medicine providers, they typically start high up here in the high force interventions, which is definitely really necessary, right? They help suppress that pathology. Whereas we really like to start down here. So we really like to set the foundation for optimal health. We treat the whole body. So we see and we understand that a lot of different lifestyle factors can really set the foundation for health, right? Or not, right? So if you don't have great factors in place, if you have chronic stress, if you don't have great sleep, if you have a pro-inflammatory diet, those can all be contributing to that disease process. So we really look at each patient and see, okay, how can we help to optimize any imbalances in those lifestyles? And then from there, we see, okay, how can we help to stimulate the self-healing? How can we address any natural symptom relief? So again, it's just a very, I'd say, bottoms up approach versus the conventional medicine. So I just wanted to share that. And then besides treating the whole body, another main thing we focus on is finding and treating the root cause. So as I mentioned, a lot of different causes for IBD in patients. How can we see specifically for each patient what's going on with them to help guide treatment, right? So we do that with a lot of different what we call functional medicine tests. So for example, for IBD specifically, ones we use often is something called a comprehensive stool test, food sensitivity testing. And then we also offer in-depth lab testing. So we can run I'd say we're really great at running a lot of different labs that your conventional provider might not run. So different like vitamins and nutrients. And again, as mentioned, if you're not like if you're having a lot of this inflammation, you're not digesting and absorbing a lot of your nutrients. So that can contribute to more of those systemic symptoms that someone might be having, like the fatigue and the weight loss. So it's really important to look at those things and see, okay, how can we help someone feel better? How can we optimize their health? So again, we offer those to do that. So I just want to go into each of these different tests to show you what exactly you would be getting into if we did decide to run one of these. So I just want to start with the stool test and show you what this report looks like, just in case we did, if in office we thought it might be beneficial to you so that you know kind of what you're getting into. So this is a really popular stool test that we run, and it's through a company called Genova. So it's a comprehensive stool test. And this looks at a lot of different markers. Okay, so as mentioned, it does look for markers of what's called dysbiosis, infections. It also looks at your metabolic imbalance, levels of inflammation, maldigestion. So this is just the overview page, okay? So let me just break down into specifics on each page. I'm not going to spend too much time on here, but I think it is important to see, again, what one of these tests might look like in case you are interested. But so this next page shows just what's called commensal abundance. So out of all the bacteria that they did test for, how much is present in you? Do you have less or do you have more than what is considered optimal? So they test this based on a healthy cohorts microbiome. So again, just helps us with individualized treatment. Out of those bacteria present, how much are contributing to inflammation? How much, so this breaks down into the specific types of bacteria and how much of each one you have present. So again, comparing to a healthy gut, where can we help to optimize you? Do you, again, have too much of a bad species or too little of a good species, or both? And how can we help you to kind of balance that out? And then, of course, do we need to help support your digestion? Do we need to help produce more short chain fatty acids in you? Again, these are just great markers for us to look at and see more for individualized treatment. This just breaks down all the different types of bacteria that they test for. So it's really great, really in depth. It does a culture to see, okay, do you have any other yeast or fungus present? Do you have certain types of pathogenic overgrowth that we need to address? Do you have any worms, protozoa, more parasites? So again, these are all important to check for because again, they can all contribute to that immune system overreaction and inflammatory response that you can see with IBD. So really important to rule out any of these going on. And then this test is great because it tells us also what natural agents are effective against the infection present. So I just wanted to share that with you. And then I do also want to share what a food sensitivity test looks like. So, whenever I say food sensitivity, that's actually different than a food allergy. So, it's a different immune response, and it's actually more of an inflammatory response. So, this tests for foods that are causing an inflammatory reaction in your gut. So, you can see how that would be beneficial to someone as we're treating them to help, again, individualize a diet plan for them to help reduce their overall inflammatory load. So this test can be great, really beneficial. It's just a finger prick, so super easy to perform. And it checks for, again, a lot of different foods. So there's different panels for different amounts of food tested for. I believe this sample tested just shows you all the different types of foods. But you can see it has +4, +3, +2. These are kind of all moderate to severe reactions. So this is great information. And then it also shows a bunch of mild reactions too on this next page. And then of foods that are okay to eat that aren't causing a response in you. So again, this just is great at helping with a diet plan for someone who is experiencing a lot of food sensitivities. A lot of the time, this is not long term. So keeping that in mind. Once we heal the gut, if we address any dysbiosis, infections present, decrease a lot of that inflammation, a lot of the time people can reintroduce a lot of these foods back in and tolerate them totally fine. But again, this can just be useful as we're on that journey to healing, right? So the last thing I just wanted to show you on this was this last page. Certain panels for this test come with what's called a gut barrier panel, and that checks for those markers of leaky gut that I was talking about before. So zonulin and occludin are two proteins that are only expressed if you do have that leaky gut, if you have the breakdown of those intestinal cells. So they check for that, and then they also check for a couple markers for more dysbiosis. So again, just helping us to guide treatment, um, more individualized treatment. Okay. So I just wanted to share those with you, and then we're going to go back to the presentation. So that's kind of the tools we use as naturopathic doctors. I hope that makes sense. So that was that. We looked at that. We looked at that. And then, of course, based on those findings, what do we do? So obviously, we work on optimizing the nutrition, giving specific diets if needed. We work on the whole body, right? So what mind-body interventions do you need to optimize your sleep and your stress? Do we need to support you with any botanical medicine or nutraceuticals? When it comes to specifically like herbs, botanical medicine, there is a bunch of great evidence-backed uh, specific herbs that have been shown to be effective against IBD. So helping to control that inflammation, that immune response, and then also herbs have been shown to be effective against any infections, right? So again, it's just helpful to test and then guide treatment to help with those responses. But a lot of a lot of different tools in our toolbox, I like to say, as naturopathic providers. So I think that's what's great is we can help to fill a lot of holes that conventional medicine might have. And then I just wanted to share a case study just in case this is helpful for anybody to see. But I had a 68-year-old female come to me who had been diagnosed with ulcerative colitis 2 years prior. And for all those 2 years, she has been suffering with symptoms. So she was suffering with the loose stools, diarrhea, frequency, urgency, and the urgency really like was affecting her quality of life. She was afraid to leave her house because she didn't know when she was going to have a bowel movement. She had to wear adult diapers. She had tried like three different medications at that point and was still having these symptoms, was still having really high inflammation on her testing, and she was having a lot of side effects from her medication. So she just wanted to see, what else we could provide her. So at that first visit, I did order the stool test and the food sensitivity test. And then I just started her on a few different things to help control her inflammation. So we did what's called a Mediterranean diet, which is a really great, just general anti-inflammatory diet plan. I started her on a high dose omega-3. That's been really great, well studied at helping to reduce not only systemic inflammation, but also specifically in the digestive tract. And then we also started her on what's called demulcent herbs. So that's a general category. There's a lot of different herbs in that category, but these are all really like thick and sticky herbs. So marshmallow root, slippery elm, those all help really to coat the gut lining and help reduce any irritation that's going on. So we started her on those things. At our follow-up, we went over her test results. So I put her stool test results on here, but you can see she had 10 out of 10 inflammation, dysbiosis, metabolic imbalance, and she did have quite a few infections present too. So based on those findings, I gave her specific herbs that were targeted to those specific infections. We talked about avoiding those food sensitivities. And then we had her continue with the first plan as well, those anti-inflammatories. About a month after I started her on those things, she actually had a really great response. So she noticed an immediate decrease in her loose stools frequency and her urgency. So all symptoms had gotten better. And this was a benefit. She was actually really excited that she lost 15 pounds. So that was good news for her. And then at that time, she had actually discussed with her conventional doctor, her prescribing doctor for her medications, that she wanted to stop them for a time. So he was actually in the process of switching her to a new one. So he was fine with her not immediately switching. So given this, like she still had resolution of her symptoms off of medications. So I think this is just like a really great success story. So she just continued to heal and get better after this. I wanted to share this because, obviously a great response. Not everyone responds this linearly. Okay. Sometimes healing isn't quite linear to all patients, but I did just want to show how it can be beneficial to do these certain things in the context of someone with IBD suffering still with symptoms. So I hope that was helpful to see. As I mentioned, I think collaboration is best. So again, it's not whether one or the other is better. It's really about like, okay, how can we really help to optimize someone's health and get them to true healing? So to do that, I really think it's a combination of conventional and naturopathic medicine. I kind of talked about this, but you saw on here, the chronic inflammation has a lot of root causes, and naturopathic medicine is just really great at helping to kind of figure out what exactly is underlying in someone and how can we really individualize treatment so they get to that optimal health that we care about. So thank you so much for listening. And I did just want to include this information on here. So I listed our phone number and then also our website. So if you did have any other questions, feel free to reach out and you can also book through any of those resources too. So yeah, thank you again.